Well, welcome. Thank you again for joining us in our series of meeting our new faculty. And today we're lucky enough to have Dr. James Mace with us today. James, welcome. Thrilled you're here in the Department of Surgery. And with these sessions, I really like to just find out a little bit about you. And for everyone who checks out our website, and Haley is trying to get the entire world to get to our website, maybe start with where you went to medical school, why you went into medicine, and we'll eventually get to the military-civilian partnership because it's Lieutenant Colonel Mace, right?
Yes, sir.
They're
That's
great.
correct.
And you can see the yes, sir. Okay. And I lived in Texas for 20 years, so it's great to hear that yes, sir.
Sure.
But anyway, James, go ahead.
Absolutely. So medicine, I wasn't entirely certain what I wanted to do as in high school, but I do know that I wanted to go to a military academy and start with the military, and that was a good kind of first step for me. That was where I wanted to be. So I ended up getting to West Point, so I did that for college. And while I was there, I wasn't real happy with all the other regular Army choices and didn't quite fit my personality. But then I realized while I was in college, the military offers people to go to medical school, and they'll pay for it, and you just pay them back time in years. And so I thought, you know what, that sounds like a really good deal, and I'll take them up on that because I've always enjoyed sort of human anatomy and physiology and studying the human body and all the college and high school courses and that kind of stuff.
And where did you grow up? What part of the country?
So my dad was in the military, and so I moved around a lot from birth till 5th grade, and then from middle school and high school was in South Carolina. So that's where I grew up.
And how was, when you first went to West Point, was it a little on the hard side?
A little bit, but it's gotten lighter over the years, as people who are older than I am will tell you. So it's kind of stressful, kind of rough at first, but you get used to it. And it turns out to be a pretty unique experience. You miss out on some of the regular college things, but there are other very unique aspects to it that kind of make up for that.
We'll have to devote a whole program to hearing about West Point, but that's really fantastic. So why cardiac surgery?
For me, it was a very long and circuitous route, I'll be honest with you. If I was a med student on day one, I would have told you, heart surgery is where I want to be, just because I was fascinated by it and the concept of it and all that kind of stuff. And so throughout med school, I kind of, strayed here and there, maybe even away from surgery at times, but definitely, surgery was always kind of the go-to thing at the end of it. And so I went into general surgery. I went to San Antonio Military Hospital. It's in Texas, and that's one of the bigger Army hospitals. So I did my 6 years there. And I kind of, to be honest with you, I sort of lost a little bit of interest in cardiothoracic surgery while I was there for a number of reasons. One is in the 2000s, people would tell you that it was a dying field with coronary stents kind of taking off.
Weren't they wrong, right?
That's right.
Wow.
Really
something.
So among those things, and to be honest, all my mentors at that hospital in residency were all basically non-fellowship trained general surgeons who had been overseas in Iraq and Afghanistan and kind of learned from their experiences. And then a big part of my residency was taking care of soldiers and people who were injured in the battlefield and were maybe burn unit patients or other
world famous burn unit there, right?
So a lot of that, I really aspired to be and emulate what my mentors were doing, and so that's what led me into general surgery at first. So I actually spent 6 years as a general surgeon in the Army before going to fellowship.
Yeah, wow. And so you ended up going to Alabama for CT training.
That's right.
And then after you finished your fellowship, or we call it residency in cardiothoracic surgery, I'm not sure why they call it residency since everyone's already done one, but anyway, that's historical.
Right.
And then what?
So it's pretty interesting. I was looking at going to Walter Reed or back to San Antonio as a very standard kind of option. But it turns out these days that the military is trying to put a lot of their surgeons and actually form trauma teams of a general surgeon, a CRNA, and a couple of nurses at various civilian hospitals. And they happen to do that in 3 places in the United States. One was in New Jersey, one was in Oregon, and the third place was here at Medical College of Wisconsin. And so these are active duty service members who were assigned to a civilian academic hospital just to augment their trauma training.
Yeah. Oh, wow, great.
And so with these sort of agreements in place, it just turned out I was at the right time, the right place, that my consultant, who's sort of the lead cardiothoracic surgeon in the Army, was arranging for those of us who were kind of coming out of training to maybe get hooked up with one of these partnerships.
Oh, that's
great.
And
then, so he reached out to Dr. Paul Pearson, who happens to have a son in the Army. And so when I talked to him, he said, you know what, James, we'd love to have you here because I know that if we train you well, then you and people like you will be overseas taking care of my son. So it turned out to be a very good both social and very beneficial agreement between 2 institutions.
Sure. So tell our viewing audience how long you've been here now.
I've been here for, so I finished fellowship in summer of 2020.
Yeah.
I went overseas for about 4.5 months right after that, just got to pay my dues. And then from
Yeah.
there, I arrived here in February of last year, so it's just over a year now.
Yeah, fantastic. It's gone by so quickly.
It has.
Yeah, and I can tell you, for everyone listening, James has had just the perfect landing. I know that Paul Pearson is thrilled with you, and everyone in the operating room is just is thrilled with your expertise and just what a great job you do all around, both in and out of the operating room. So congratulations on a great landing. It really has been great. What do you like to do outside of work?
I'm married. I have 2 children, 2 daughters. One's in 3rd grade and 5th grade, so a little bit older. So we try to, make the most of where we live, where it's Alabama or South Carolina, Georgia, where I was a general surgeon, and now Wisconsin. Kind of make the most of where we
So
live.
the family's used to it then. They're used
A little
to
bit.
traveling around.
It doesn't
Yeah.
get any easier each time, unfortunately, but we
Sure.
make the most of
Yeah.
it, and so we'll do various family things. We went to Chicago here this past spring break for a few days to see some museums and
Great.
that kind of stuff. And otherwise, my own hobby is probably more do-it-yourself projects. I like to remodel things at the house, and
Yeah.
again, kind of use my hands for doing stuff, but in a creative
that's great.
capacity.
So what's in the future for Dr. James Mace then? Where do you see yourself 5 and 10 years from now?
Good question. I'll find that out here over time, but
Yeah.
certainly the next few years, I'd love to kind of stick around here for a few more years after my official assignment with the Army. If they'll let me stay longer, I will. Just depends on the needs of the Army and what's going on throughout the world and throughout military hospitals. So if I can, and as far as cardiac surgery, that's my main focus, is just doing cardiac. I really enjoy the academic aspect of cardiac surgery for a number of reasons. Probably the challenge is first and foremost. We take care of some very complicated patients, and many cases I see throughout the week and taking call are just really kind of stretch the limits of what I think can be done, or
Sure.
push my comfort zone as far as what
Yeah.
can be done. So I really enjoy that challenging aspect of academic medicine.
And it's great to have a team.
It
I
is.
mean, something this probably brings you back to West Point a little bit, the way the division interacts. And for those people who aren't as familiar with our division of cardiothoracic surgery, Paul Pearson is the division chief, and it's just a wonderful group. I mean, I think if I was a resident and got to work with all of you, I'd probably go in. I don't know that cardiac surgery would accept me, but I would probably want to be a heart surgeon. It's just really a fantastic group.
Thank you.
So, James, thanks so much for spending a few minutes with us, and this will be on our website, and everyone will know a lot more about Dr. James Mace. So thanks very much. Haley, thanks a lot.
Thank you.